Today, let's talk about the symptoms of autism. In future videos, we'll discuss how they show up differently in kids versus adults, how they show up in women, in men, in boys, in girls, and different minority populations, etc. Today, we're just going through the symptoms, right? So there are 7 symptoms of autism altogether, and they are grouped into 2 categories. Category A is mainly around social communication interaction. Now, symptoms of category A need to be present. All 3 of these symptoms have to be present in an individual in order to diagnose autism. So let's talk about those. First one being difficulties in social emotional reciprocity. An example of this will be that person that could be in a room where everybody else is doing one thing, but because that thing is not an area of interest for them, they couldn't care less. So everybody's over there and they're right here because they don't get the innate feeling that if everybody else is doing something, maybe it's socially acceptable for me to join in. The next one here is difficulties in nonverbal communicative behaviors. An example of how this shows up is a tendency to know about or use very limited gestures. So typically when you're speaking, as you can see, like I'm hand movements and my gestures kind of draw you towards what I'm doing and they make quote unquote make sense. Some individuals on the spectrum have very limited, gestural use or understanding of them, especially when they're children. So, for example, if you tell a child, look over there, the non-autistic child will look over there and follow your hand. My son couldn't care less, doesn't understand what look over there means, or the fact that because I pointed there, that he should look over there. Right. So that's one example of those difficulties in nonverbal communicative behaviors. The next one here is difficulties in developing, maintaining, and understanding relationships. One thing that we all do to keep relationships going is we tweak who we are depending on the people we're around. However, many individuals on the spectrum do not do that. Who they are is who they are, whether they are at home, whether they are at church, whether they are at school, whether they are with their closest friends and family, or they are with a stranger. Right? Now, this is an example, and not everybody presents that way, but that's a way that this symptom would look like in some people. Right? Now, like I said, these 3 symptoms, keeping in mind different presentations or variations in presentation, need to be present. Now, any 2 of the symptoms in criterion B, in addition to these 3, would be enough to diagnose autism. So let's go through the symptoms in criterion B. First one here, repetitive motor movements, use of objects or speech. So, stereotypically, you're going to see things like hand flapping, finger tapping, walking on tippy toes while flailing. Those are some things that some individuals on the spectrum do, whereby the movement do not necessarily, to other people at least, serve any purpose, right? There are also times when it's a case of how they use objects. So, for example, my son, before he was diagnosed, if you gave him a toy car, instead of what the other kids would do, which would be to go roll it on the floor and go like, woo, 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 he would roll it on his lips. And almost every time that's what he did. So that's a repetitive movement that do not necessarily fit with how the object is supposed to be used. So that's a symptom. Next one here, insistence on sameness. Now, many people are seeing kids struggle significantly with transition. Sometimes for individuals on the spectrum, it's another level, right? Where any changes, no matter how trivial, cause significant difficulties for them. So that's one example. The next one here is restricted interest, right? The remainder of this criteria is restricted interests that are abnormal in intensity. So this person loves to learn and talk about and dive into a particular topic in a way that they can talk about it all day, and more importantly, not even realize if nobody in the room cares for it. It will be that friend that with the moment you see them, you go like, there he comes again, we're going to talk about this. Now let's talk about sensory issues. And sensory issues can present in a hypersensitivity to sensory things or hyporeactivity. So an example of the hypo, because I think the hyper is more common, many people know about it, that would be the kid that, maybe you turn on the microwave and, hand goes to the ears because to them that is so loud. Hyporeactivity, an example of that typically is around pain. Something happens and you expect that, hey, you fell this loudly and no crying, they go around. Sometimes they even get hurt and they may not even notice it or realize it until you see it, right? So that's an example of the sensory-related things. So these are the 7 symptoms of autism. 3 here need to be present and at least 2 here need to be present. And then we have to answer these questions down here. C, age of onset. Have these symptoms been present since the early developmental period? So autism is a neurodevelopmental disorder, meaning that for people who have it, you've always had it. So if you can almost trace these symptoms to 2 years ago when COVID hit, you likely don't have autism. The next one here is impairment in multiple settings. If you can say that, oh, my symptoms are only an issue when I'm talking to this person, or when I'm at home, but oh, when I'm out and about, it's no issue at all. Or it's only an issue when I'm at work, but at home, at school, at church, it's no issue at all. We are likely not talking about autism. And lastly, are these symptoms better explained by something else? Right? So, for example, think about a 20-year-old who was doing, growing up, was doing well, had great friendships, everything was great. But when they were maybe 8, the family moved, and to the new environment that they went, they didn't feel like they related to anybody else there, and they began to pull back. Right. So since age 8, they've been more socially isolated, have limited skills when it comes to social interactions. And so now they're having all these difficulties, right? That person, the change in environment, social anxiety may be most likely better explain the symptoms. And so that person likely does not meet criteria for autism. Okay. Subscribe to the YouTube channel, follow the pages. There'll be more coming. All right. Peace.